My name is Ibrahim Otman, Public Relations Officer for the Ionographic. Today I'm here with Professor Peter Oladapo Adeoye of the Department of Surgery. He completed his secondary education from the Government High School Ilorin. He attended Adeoye University, where he obtained his MD/PS degree in 1991. He also did his residency program at the University of Ilorin Teaching Hospital from the year 1994 to 2001. It's a real honor for us to be here with you, Professor Adeoye.
Thank you very much, Opa.
Professor Adeoye is having the 216th inaugural lecture at the University Auditorium on Thursday, February 10th, 2022, which you are all invited. Today we will be discussing one or two things with the Prof, and we would like to get to know the Prof better and for him to share an insight into some of his works. So I'll first start by asking you once again to please introduce yourself back to our audience.
Okay, so as rightly said by Whitman, I am Peter Oladapo Adeoye, and I've gone through the government high school, Ilorin, to ABU, and I did my residency in general surgery and UITH before I went for a post-fellowship specialization in Cardiothoracic Surgery. And so I've been employed at the University of Ilorin and the teaching hospital as a thoracic and cardiovascular surgeon.
As over 55 publications, he has been read over 7,400 times. He has over 265 citations. He has really done a lot in the field of medicine. So I would like to ask you, what made you go into medicine, most especially cardiothoracic surgery?
Well, I think it was my father that endeared me to the medical profession. He also being a medical doctor, and I saw the way he lived. He was very prompt, would not want to be late for any program, and he was very meticulous in doing his things. And a couple of times I've seen him attend I saw him attend to his patients, and he was quite compassionate and gentle in handling his patients. So that was all that made me interested in medicine, and I made up my mind to do that. And I made up my mind right from my primary school days that I saw him do like this. As to the surgical discipline, my interest in surgery started from my preclinical days, because one of the aspects that I loved most was anatomy, and I loved dissection. All right, so you know that we do dissection in groups. I would always strive to be the one making the dissection. Now I know most people work on prosected specimen to study anatomy, but in our medical school days, we did the dissection ourselves, and it was quite interesting to me, and that was what probably spurred me into surgery. Initially, I wanted to do neurosurgery, but as it were, I changed my mind, because I discovered that most neurosurgical patients have a chronic ailment, and I found it difficult to see my patients linger on for a very long time. It caused some emotional disturbance to me. I noticed this right from the time I started the residency, and so my interest just went straight to cardiothoracic surgery as a subspecialty.
That's really nice. That's really nice. The lecture for your inaugural topic is battling to keep our hearts. Who will heal the bleeding hearts? What prompted you choosing this topic?
Well, I would not want to espouse what the inaugural lecture is about today, not yet. I would rather still leave people guessing about it. But I'll tell you two things. If you look at that topic in the literal meaning of it, if someone should have a bleed from the heart, say from a trauma, penetrating trauma to the heart, you would realize that to get it repaired promptly to save that person's life is going to require a lot of effort, promptness, and you need to be expeditious. You have to open through the chest, get to the bleeder, repair it. You cannot do it alone. You need team effort for you to move that fast and with precision to be able to repair it. So that tells you how challenging it is to save a heart that may be bleeding. That's a literal meaning. But let us look at it metaphorically. If you say a heart bleeds, that means there's a hurt to the heart. There's a burden on the heart. Okay? So how do we relieve this burden in order to make sure that all hearts of our patients are in good condition? That's the best I can tell you.
Thank you very much, sir. Over the years, you've gained experience, you've seen so many things. If you had to restart again, are there things you feel you do different? If you're given like the ability to maybe decide to do something different, is there anything you feel you have done different?
Well, that is quite a difficult question because to look at my career path probably has been rather tortuous. If anything, probably I would have wanted a place where I could have done my thoracic surgery, cardiothoracic surgery specialty as a straight training. I had to go a convoluted path. I finished general surgery fellowship, which took about 5 years, from 1994 to 2001. All right, and then after that, I then went on another 4 years for thoracic and cardiovascular surgery. So that I would have preferred if I had a circumstance that allowed me to do the thoracic and cardiovascular surgery straight instead of having to do general surgical training in the first instance. Because number one, I would have been able to concentrate earlier, and then I would probably spend a shorter period of time doing the training. But the situation in the country as at the time did not permit me to be able to do that as a straight program. As to places where I've worked and all those, well, I would not say I have a regret. I can only say I thank God for the opportunity that I've had, for the exposure that I've been able to achieve, and for the patients that I have been able to save or make better in life. Yeah.
Thank you very much. What other things do you think medical students or graduates can venture into beyond medical school? Do you think it's possible to actually?
Yes, absolutely. I think it's possible for medical students to venture into other things. One thing is a number of medical students probably come in because their parents have encouraged them or wish that they become doctors. I think a high percentage of students did that. So that you will find that there are few students who came in because of their genuine interest in coming into medicine. So if that is the situation, I know that quite a number of students would have some other passion in life, things that is basically of intrinsic interest to them. And if they do have that, I think they should be able to pursue it. They may pursue it as a major activity, or just as as a minor one in addition to their medical practice. And why I say this now is because the Vice Chancellor appointed me as a director of the Technical and Entrepreneurship Center of the university since 2020, and I've seen the diverse opportunities that exist in entrepreneurship, so that if even the medical student that is training as a doctor, he should look at a wider scope of entrepreneurship in medical practice, even if it's going to. So you could graduate as a medical doctor, for instance, and you are exposed to importing medical equipment, for instance. Because of your wide scope or the various equipments that are available, you can get good equipment that are of high standard. And yet, that is entirely a business venture for you. And if you look at it, you could even venture to something entirely different. We have had graduates of medical or from the medical school of Ilumsa who have gone into pure fashion, all right, and they have their own fashion outlet, they have their own fashion label, and they are making a lot of money from it. You see, so it is not merely medical practice alone. Your horizon should be open to opportunities, and that is going to further enhance your living and your livelihood in life.
Thank you very much, Thank you very much. Has really been an enlightening session for me. I've really had so much. And what advice do you have for other medical students, people that will view these things? Like, what advice? Because these are medical school, people fight with stuff, so many things going on, people are struggling, people are struggling. But all in all, you are someone that you've been in this environment for so many years, and I know there are one or two things we have seen, and you can pinpoint and you can advise the students generally.
I think the medical students need to be focused to the program. Medical school has never been an easy thing to handle. In fact, when I was getting to medical school, the elder person who advised me said, "Congratulations that you have gotten your admission into medical school. However, note that it is easier to gain admission into medicine than to stay in medicine." Right? So that already passed an information to me that I needed to buckle up in order to sustain my stay in medicine and graduate as a doctor. So if we keep that in mind, we need to really be focused on what we are doing. What is needed most for a medical student is consistency in learning. When I say consistency, it is not when exam is coming that you then want to rush and read all the things that you need. Consistency means that you are at every program that is designed and at the appropriate time, and you read them as you go, so that every aspect of medical training is important: laboratory, ward round, theater, clinics, lectures. You understand? Every aspect is important so that you are there. There are so many things that you can learn passively in medicine by passive technique, because by you merely saying it repeatedly, hearing it be said repeatedly, it already becomes part of you. Also, you need to also learn and instill morals of the medical practice. Medical doctors have ever been known from history. The profession has ever been known to be a noble profession, so that when you finish, you are standing at a high standard in the society. You are a model that people are looking at. So it's not just learning the requisite knowledge of medicine, but imbibing the noble attitude of the profession, so that you can be found to be an excellent citizen wherever you are going to practice. And I'm emphasizing the word wherever you are going to practice. That means all over the world. Because once you are coming out as a medical doctor, you should be able to practice effectively anywhere in the world and still give good moral attitude to your patients when you see them. I think that's what I'm going to advise the students today.
Once again, the topic of your inaugural lecture, battling to keep our hearts, who will heal the bleeding hearts. So, as a form of publicity for the inaugural lecture on Thursday, we would like you to encourage the students and to tell them a bit more, to show them the reason why, to emphasize the importance of why they should be at the event.
So, again, battling to keep our hearts, who will heal the bleeding heart. There's a sub-theme to it actually. It says innovation in the practice of cardiothoracic surgery. That's a sub-theme to the title. So I would encourage students of your association to also attend, because it will highlight how one has been able to survive practicing in this, in quotes, difficult subspecialty in our environment. What we have been able to achieve in that period, despite the challenges that one is facing, and also to be able to encourage students not to run away from the subspecialty. You understand? So they would be able to see the array of conditions that we have been able to handle, not just in UITH, even in Nigeria, and how far we have tried to prepare the ground for a better subspecialty training in cardiothoracic surgery. There are still quite very few numbers of cardiothoracic surgeons in Nigeria as of today, not sufficient to meet the number of patients. We probably have about 75 to serve about 200 million people. So we need more people. So I believe that if medical students, they have a lecture, I will be able to pick 5 students who in future will venture into becoming specialist thoracic and cardiovascular surgeons.
Big congratulations once again. It's a really big honor, and we hope one day we will have cause to celebrate as you have. Thank you very much. I really appreciate it. Thank you very much.